Making sure people can live where they want and how they want. That's what makes caregivers so critical for so many families here in Arizona and across the country. So Monday, you saw my story profiling high school students, learning the ins and outs of becoming personal care workers. And after listening to this group, I learned there's another issue this industry is trying to solve.
We work with people where they live. We meet them where they're at.
And more for older adults and people with disabilities. That place is at home. What makes you so passionate about home care?
I love this job because it inspires me every day to be a better version of myself.
And in turn, Sarah Wilson and Home Assist Health are helping others be the best versions of themselves as well. As a nonprofit, the group assists hundreds of people across the valley continue to live independent lives.
Home care is where we're going to help people with activities of daily living. So when you think about everything you do from the minute you wake up to when you go to sleep, all those activities are required to be completed to live an independent, healthy, and safe life.
Things like cooking, cleaning, transportation, and everything in between. And with our elderly population increasing, these workers are in high demand. By 2050, the number of people 65 and older will nearly double in this country, going from 48 million to 88 million, according to a recent study from PHI, an advocacy group for elder and disability care. Those numbers mean more care workers will be needed at all levels. In fact, the Bureau of Labor Statistics says the field will grow by 22% over the next decade, which is much faster than the national average. But at a time when these workers are needed more than ever, Sarah says the field is in need of some TLC of its own.
Currently, most people receive services through Medicaid or state funding, and it's not affordable to pay out of your own pocket. And at this time, the state is not actually funding it to its full potential because of inflation and the rise in minimum wage.
It's something a recent report by Mercer also backs up. Last fall, the government consulting group said that in Arizona, quote, the fee schedule rates have not been reestablished in many years, and existing rates are not keeping pace with current provider costs of special delivery. Sarah says that's not the only issue.
We're competing against those that can access higher dollars for that workforce. While somebody may choose home care or caregiving, they can't afford to choose it.
If we don't do something to change this, what's your fear?
You're going to have higher costs hit the entire system.
And Sarah told me she worries those higher costs will filter down to all of us. She also said more companies are closing or consolidating, which means eliminating competition. Finally, some companies may need to eliminate services to cut costs. Now, I did reach out to Access and asked them to comment on that study I referenced. I have not gotten a statement yet, but will continue to push for answers. In the meantime, a spokesperson told me providers negotiate rates directly with health plans and healthcare companies. But Sarah told me there's a trickle-down effect. So if those companies are not getting reimbursed at a high enough rate, Sarah says it really is a ripple effect, and they're going to feel it on the back end. Access did tell me they have an online career portal to help recruit workers, which we know is another issue in this field. For more information on that, head to the main page of abc15.com.